Hello, welcome back to Pharma Training Solutions. Today I'll be discussing opioid, analgesics, and antimigraine, which are those agents. Now, of course, we know that opioid alkaloids produce analgesia through the actions at different receptors within the CNS, which are the MOP or the mu, the KOP, the kappa, and the gamma, the DOP. Now, that respond to certain endogenous peptides with opioid-like pharmacological properties. Now, those endogenous peptides include endorphins, enkephalins, and dynorphins. Now, of course, binding of an agonist on the receptors, which is coupled to inhibitory GI or the inhibitory G protein, leads to closing of the voltage-sensitive calcium channels on the presynaptic nerve terminals, and thereby reduces transmitter release and stimulates efflux of potassium ions via the potassium channels, leading to hyperpolarization. Now, all this one, they leads to no generation of action potential, which means that if no action potential is generated, there will be no impulse, which will be transmitted the CNS for pain. Now, of course, we know that opioid analgesics produce their effects mostly through the mu receptor, which is located throughout the CNS and other centers. Let me briefly talk about the effects. We have analgesia, sedation, euphoria, because we know morphine is a drug of abuse. If trauma or those one can be abused by patient, can be abused by patient. Even one time there was a documentary on BBC about paytex with codeine abuse in Nigeria. I hope you remember all those. Now, we also have cough suppression, respiratory depression. These are the effects, and also nausea and vomiting. Remember, when we were talking about the emetic drugs, we talked about apomorphine. Also, via the KOP receptors or the kappa, we can have psychotomimetic or which can cause nightmares and hallucination. However, also the mu receptors are located in the GIT, the peripheral GIT, and this one they lead to diminished propulsive peristalsis. And what does this one lead to? Of course, this one leads to constipation, because when we have diminished peristalsis, there will be constipation. Now, which are those opioid analgesics? The examples are morphine, methadone, oxycodone, codone, meperidine, codeine, and all these other one. Now, let me talk about therapeutic uses. Of course, there is analgesia, especially severe pain, severe pain in cancer, as palliative care, of course, and also in bone or this one. And of course, during obstetric labor, sometimes they could be used like pethidine. But mostly in surgery, bone or this one, they use pethidine. Now, also suppression of cough, especially with codeine, and they can be used to control diarrhea, especially cancer patients. And sometimes they are used as adjunct therapy or medicament drugs before anesthesia. Now, side effects of opioids, we have respiratory depression, because this one is a common one, nausea and vomiting, constipation, and urinary irritation. Now, there are terms that I wanted to describe, but I'm sure you can come up with them: tolerance, dependence, and addiction, because we know that these are the common drugs which are abused within the patients, especially morphine, pethidine, and trauma. Even some of our health professionals are doing so, which is very bad. Which professionals who are addicts, very sad. Now, let me briefly explain each one in the short form. Because we know morphine is strong analgesic, strong agonist, and used for severe pain. Methadone is used to relieve difficult to treat pain, those who are unresponsive to morphine. However, it is also used in management of opioid abuse as a detoxicant. Now, why? Of course, it has a reason which you can search, or you can contact us for more information. We have meperidine, of course, is an opioid with antimuscarinic effects. Fentanyl, this one is used in anesthesia and also management of severe pain. Oxycodone, this one is a more potent, given alone in high doses, treat moderate to severe pain. Codeine is antitussive, by way meaning it is used in cough suppression. Dextromethorphan, it also acts centrally to elevate threshold of pain. However, it is preferred over codeine as it causes no dependency. Because this one is the opioid-like, because I was supposed to put it at the end, but I just put it here. These are opioid-like drugs, like the next one, the next slide. Loperamide, this is of course opioid-like medicine. They are used to control diarrhea as it possesses action on peripheral mu opioid receptors. Of course, we know that it will reduce the gastric, the GIT tone, epidistylisis tone, and of course we know this is called Camodium or Imodium in the pharmacies. Tramadol is also partially it is a weak opioid agonist, but central acting analgesic. But it is a blocker of serotonin reuptake and inhibit the norepinephrine transporter function. It is a weak receptor antagonist, but it is partially antagonized by naloxone. That's why we bring it in opioids. Now, some other drugs which maybe I've not talked about, like pethidine. There are very many others which I'm sure you have. Opioids with mixed receptor actions. We have the buprenorphine, nalbuphine, and pentazocine. These ones have kappa antagonist and at the same time mu. Also the kappa receptor agonist and the mu receptor antagonist or partial agonist and psycho to effects with hallucination, nightmares. This one. So I've not talked about drugs like pethidine because this is a short presentation, but I'm sure you are aware of, because it was supposed to come here. All of them are supposed to come here. Now, of course, let us look at the opioid antagonist. The common one used is naloxone. Others are naltrexone and nalmefene. They have relatively high affinity for mu receptor binding sites and reverse the opioid effects in patients with severe respiratory depression or what we call opioid overdose. Antimigraine, of course, you know that migraine is severe throbbing pain or pulsing sensation, usually on one side of the head and often accompanied by nausea and vomiting or an extreme sensitivity to light and sound. Of course, all of us know migraine, difficult to treat headache. Examples: we have the triptan drugs, like these are, of course, they block the serotonin 5-HT1B antagonists. Examples: we have the sumatriptan, triptan, egotamine. This one is then egot alkaloid, also used amitriptyline. Others can also be used. Remember, these are short presentations. Yeah, I'm sure you can get more information, or you can contact us for more clarity. Thank you for listening to me. These are the other presentations which we have in the CNS. You can also refer to them. I always remain Wilson from M-Pharma Training Solutions. Subscribe to my channel. Contact us for more information. Shall always reply. Leave a comment on how we can improve. Give us a thumbs up. Subscribe. And thank you very much.